you see as some of the key trends in oncology that are most important to manufacturers?
So the first thing to think about is that cancer is not a monolith. For the longest period of time, patients said, I've got cancer and I'm going to die. And non-oncology physicians would say, we have very little to offer, but I'm going to refer you to the oncologist anyway. That's all changed. Now, at the level of cancer as a broad category and the diseases that make up the malignancy continuum today, there are unique elements within each of those disease groups driven by specific molecular pathways. And understanding these different subsets allows us to target treatment and personalize medicine down to the level of the individual patient. It's a totally different concept from certainly several decades ago and really has come to fruition over the last 8 to 10 years.
So do you see this as an opportunity or a threat for manufacturers?
It's certainly a huge opportunity. The molecular biology has exposed pathways within cancer tissues that are aberrant in some way. So understanding those pathways tells us where the target is. And if we can develop reagents, therapeutics, to block those aberrant pathways, we have an opportunity to make tumors shrink. And by focusing on pathways that are largely unique to cancer as opposed to normal tissues, we can diminish the side effects that are traditionally such a concern when we talk about traditional cancer treatment approaches.
What if I don't have the targeted therapy? If I'm the brand manager for the product that's out there, I see it just as an encroachment on my market share.
Well, let's be clear that today targeted therapies are what's being developed. But there are very worthwhile chemotherapy agents or hormonal therapy agents that are still available and still providing tremendous benefit to large numbers of patients. Even with more traditional chemotherapies, we better understand whether or not the target for those treatments really exists in a group of patients and can further allow us to enrich the population to be treated and enhance the benefits even for treatments that have been around for a while. Today, many large pharma companies have major research divisions, and even the small boutique companies and biotech firms are built around this kind of molecular science. So there's no target that emerges completely from out in left field. Yes, things may have a little bit of a time frame of emergence, but it means that many manufacturers and developers of new reagents are going to be focusing on that same target. So discipline in understanding the target, managing clinical development so as to study the right patient populations and define the right clinical trial endpoints, and creating specific drugs that have the best pharmaceutic features, that have a longer half-life, or are easily taken both with and without food, or aren't associated with cardiac toxicity features, or some of the other limitations that can make their way into black box warnings. And for managers, the risk is that everybody knows the target. The holy grail is to find people whose tumors bear that target and then create a therapeutic agent that optimally both blocks that pathway and protects normal tissues, is well tolerated, and has other features that make it appealing as a drug. We would say the mix of efficacy and tolerability, what we call therapeutic index, favors that agent versus that agent. That's the manufacturer's challenge. And then bringing that through the development path.
Patient-reported outcomes. How does that fit into that was one of the trends we had talked about as a a new emerging trend important in the oncology arena?
First of all, recognize that patients now understand that they can access information. So the web is a great enabler. The advocacy groups that make information available and create chats and allow people to understand what the experience might be like. And then the patient being able to share back with the provider about what the experience was like and how my tolerance of treatment fits into my ability to adhere to the treatment schedule that you've prescribed. Our need as providers to offer them sort of preemptive or prophylactic advice and strategies for managing expected side effects are all critically important. So patients understand their disease better, they understand the therapy better, and they want to be partners because they know if they can adhere to the therapy, if they can prospectively understand the side effects that may be coming and manage those side effects, they have a great chance in the era of targeted therapy of having the benefits they want, feeling better, tumor shrinking, living longer, all the things we all aspire to.